Welcome to Orange Hub Podcasts. My name is Angela Bakari. People call me Bubbly Angela because I talk a lot. Today we are going to talk about mental health on the 10th of October. It has been being commemorated in Zimbabwe since 1992. And along with it, it has been going along with the SDG number 3, which is good health and mental health, as well as according to our Mental Health Act, which was revised in 2025. Here I'm with two guys from the call center. I've got on my right the one from the discipline of psychology, and on my left to the guy from the discipline of social work. Let them introduce themselves. Mr. Guy from psychology.
All right, so my name is Ryan Jim. I'm from the call center department, a psychologist in training, and I'm also known as Jola as a nickname.
Wow.
Yeah.
My name is Toret Nashe. They actually call me Tainash. I'm from the discipline of social work.
There you are, guys. Today we are talking about turning awareness into action. Yes, we've been talking about people being aware, we've been educated. I'm sure most organizations, including our organization, SAYWHAT 577, has been advocating for mental health. Today we want to talk, what is it about mental health? What are we talking, what are we saying about mental health? What action are we taking into consideration? Before we embark into our topic, I want the guy from psychology, Ryan. I want Ryan to talk about the definition and the related mental health diseases around mental health.
All right, thank you, Angela. So firstly, I'm going to define what mental health is. So mental health, it refers to the psychological, emotional, and social well-being of a person. It affects how we think, how we behave, and it influences how we relate to others, and also it influences how we manage our stresses. Yeah, I think that's basically what mental health is.
Okay. That's good. Now we know the definition about mental health. What are the diseases related to mental health?
Mental health disorders.
Yes.
So we have many mental health disorders. So I'm going to talk about, there is what we call is substance abuse disorder. There is anxiety disorder. There's bipolar. There's schizophrenia, eating disorder, and there's also sleeping disorders, amongst many. Yeah.
I'm surprised. Substance abuse, is it a disorder?
Yeah, it's a disorder. Like I said in the definition, social well-being, if someone ventures into drugs, it means he or she is struggling to manage stress or pressure, and he then tends to do drugs. It's a disorder. Yeah.
Then I must say it was call 577. I've got an eating disorder. Is it a disorder as well?
Yeah, it's a disorder.
Oh my goodness. All right, guys, we want to go into intervention methods. We have heard about the diseases around mental health. Tinash here, Tainash. I hope I've done it very well. Tainash.
Yes, Tainash.
Tainash is going to talk about the intervention methods that we can have around mental health.
Okay, thank you, Angela. Actually, mental health is actually a very crucial aspect in our life. We are not spared as youth, the AMA 2K generation.
Yeah.
We are actually suffering from mental health issues. As Mr. Ryan said about different conditions of mental health disorders, we actually do have different ways of intervention as well as treatment. But what must be in our mind, guys, is this: mental health is actually a condition sometimes. Yes, of course, sometimes it can be a disease, but sometimes mental health issues cannot be treated, actually can be managed. So basically, within the path of intervention, let us be aware of the early intervention. The early intervention, it plays a pivotal role in the aspect of mental health issues. Let us early detect any signs of mental health sometimes to be alert with mental health aspects, it actually helps us to navigate so that the mental health issues cannot proceed to an untreated condition. So we can actually be able to manage mental health, and sometimes we can actually be able to cure that mental health issues. As Mr. Ryan mentioned about different mental health conditions, for instance, let us talk about the issue of depression. Depression is actually a very serious mental health issue that is devastating some of our youth lives. Remember, we are not spared from these mental health issues. It can actually affect any age. The children, the youth, even the elderly people, they are actually suffering from different types or condition of mental health issues. So, talking about depression, depression is actually starts at the initial stage as stress, but as it is progressing, it actually results in different difficult aspects, such as negative, for instance, loss of life, chayo, munano tofa, kutifi, depression. So depression is actually a very serious mental health issue, which actually need early detection of the early signs so that you can actually be able to help and assist a person who is suffering from depression. So depression is actually a very serious mental health issue. Talking about schizophrenia disorder. Schizophrenia disorder, sometimes it can actually start with different signs. For instance, a person who is actually suffering from depression do actually suffer from even withdrawal, social withdrawals, failing to have a stable relationship with other people, and sometimes accompanied with hallucination. Sometimes a person can perceive different hallucinations even through the sense of sight, the sense of feeling, and even the sense of hearing. This is schizophrenia. So, in this juncture, dealing with the schizophrenia disorder, we can actually embark in intervention like cognitive behavioral therapy. Actually, we actually do have our professionals, social workers and psychologists who can actually help to navigate the issue of schizophrenia disorder through accompanying with the therapy, which is actually known as cognitive behavioral therapy. This cognitive behavioral therapy, it actually starts with the identification of the negative thoughts within the mindset. So when there's actually the detection of the negative thoughts, those negative thoughts can be actually addressed at an early stage. But remember, schizophrenia, when it actually affects a person, it can be managed, cannot be actually cured. Talking about bipolar disorder, whereby bipolar is now a combination of different disorders. For instance, we can be actually having depression and pneumonia in that. So which means these two combinations of bipolar can actually result even in loss of life of a person if not addressed properly. Thanks to SAYWHAT, because SAYWHAT is there for you. If a person is suffering from any type of disorder, SAYWHAT is there for you. Don't die alone. SAYWHAT is there to provide you with psychosocial support and even referral to the organization that actually can be able to diagnose different conditions of disorders. Thank you, Miss Angela.
You have heard it from the man himself, the social worker, that even mental health is a problem. There is also something we want to add from Ryan.
Yeah, I want to add on the interventions.
Okay.
You know, some of the mental health disorders, they are biological, which means they can be passed from the parents to the child. So as an early intervention, I think it's wise for parents, if they know they had suffered from some of those disorders, I think it's wise for them to get their child checked as an early interventions and get treatment before it worsens. I think that's an early intervention which we must take care of.
Oh, you've heard it from the man himself, the psychologist in the house. Thank you so much, Mr. Ryan, for that addition. Oh, it comes from biological. You inherit from the mother before you are born, in the womb.
Yes.
Mental health is something else, guys. But I'm happy that today you have been enlightened, and I'm sure you know where you can get help. Say What organization, we've got a call center 24/7. It means that anytime you call, whether it's 12 midnight, 1 a.m., we are always available with a group of professionals. 577 is our toll-free number, which you can call on Econet line. There are also other platforms where we can get assistance in Zimbabwe, like the 116, the Child Protection and Care. As we have heard, the child protection is mental health, right, guys, from the professionals?
Yeah.
Okay. And also 988 suicide. This is a life crisis lifeline, suicide line, where people can also get assistance. Is it suicide mental health, guys?
Yeah,
Yes.
it's a result of
Yes,
mental
so
health.
mental health is a broad term. Unfortunately, we could have talked about it the whole day, but we can't talk about it the whole day. We'll just say it in segments. And this is, we are going to the final segment of our topic of mental health today and emphasizing on 577. Any words to conclude, a social worker?
Okay, thank you, Angela. Okay, guys, mental health, as we already said, that this is a very serious and crucial aspect whereby anyone and any of you have to take care of this mental health issue because it actually leads even to death. So let us not hesitate to share if you are having any difficulty, if you are carrying any burden inside your mind. Please be open to others, share with others. You and me, we have a duty to save life from mental health issues because mental health issues cannot be dealt with. So let us be cautious in dealing with mental health issues. Let us provide psychosocial support. Let us provide family support. Let us provide cognitive behavioral therapy, even actually finding even biomedical support. For instance, within the biomedical segment, you can be actually assisted medically through the use of antidepressants. You can be actually assisted through the electroconvulsive therapy, which actually help you to navigate any challenge you are facing through the mental health issues. We are not alone. We together, we can make a difference. Let us challenge mental health issues. Let us save life. 577 is there for you to save your life.
All right, Mr. Ryan, any message, anything to the youth?
Well, so I just want to say to the youth that your mental health matters. Don't be shy or anything to talk about your mental illnesses. It's not a burden. It's something which can happen. So I think you should communicate with others. And there are also institutes like where they can help you with medicines or what for those suffering from those disorders, like the Annex at Parenyatwa, Ray of Hope, and many other institutions which can help you. So call 577. We can help you at SAYWHAT. We offer what we call psychosocial therapy. We can give you that over the phone, or we can do any walk-in, and we can also help you. I think that's all. Thank you, Angela.
Thank you, guys. 577, non-judgmental, confidentiality, high up there. No one is going to share anything. Feel free. There is nothing you can say, you can't say, or you can say to us. We are always available. Thank you for watching Orange Hub Podcasts. I've been your host, Bubbly Angela. See you next time.